Doctor, well, if you have cancer, if one has cancer, it's a death sentence. No doubt about that. There's no cure. All right.
In this country, you can use that to that extent. You can in this country, in Australia, in other developed countries, I might have that reservation. Yeah, but in Papua New Guinea, I can say it's a death sentence. In Papua New Guinea, I can see the death sentence.
Wow.
And I have reasons to say that.
Okay, okay. What can you tell the people out there that cancer is a death sentence in this country, what they need to do to prevent getting cancer, and if they have it, what do they do? What is your advice?
At the hospital, we see patients to come in with the late stages of cancer. First onset, maybe a small sore, maybe ulcer, and it's just another lump or something, and they stay away from coming to the hospitals and clinics. They stay until when the skin is off or taken out, and then the sore becomes ripen up. Yeah. And then that's the time when they come in. That's where we said they are stage 3 or stage 4 or advanced states. So that's when we can't do much. We can only look after the pain, maybe pain medicine. We can only do a little bit of surgery to help, but in terms of the real outcome, we don't get much that satisfactory outcome. No. Because most of our patients, they come in very late in the presentation to the hospitals. Okay. The other thing is that in terms of the care, in terms of cancer care we give in this country, both in terms of hospital-based care and outside of hospital care is not proper, it's not good. Okay. The cancer service in this country in terms of treatment is not up to the standard, up to expected standard. No.
And you said it's increasing, so something needs to be done here.
Definitely. Mm-hmm. The number of increasing, the frequency is increasing. The treatment is not on par. Or the care is not on par. Okay. And I tend to look and say, what's the problem? Where is the problem? And I look back and I see, because the responsible government agency is the Health Department, National Health Department. And when I look at the National Health Department plan for the next 10 years, 2010, 2020, they don't capture cancer in there.
Wow. We've got a problem there. Doctor, you also are a lecturer at University of Papua New Guinea. What do you do there? Do you pass that on to your students? What is it?
I teach surgery, not only cancer, but general surgery. But when it comes to cancer, I advocate to my students that we need to be seriously address this, but the patients need to be aware that our community needs to be aware. By the way, community needs to be aware of issues about cancers and what they need to do for themselves, so that at least on the bigger picture they must aware that even it's a small flu or you have coughing out the blood or if there's a lump in the breast, must quickly go to the hospital. Okay. Yeah, it might be just infection. That's fine. It might be something more than infection.
True.
It might be cancer, and it's nice to deal with it in the first instant, then delaying it when we don't have the support system to look after.
Yes. Doctor, it's frightening to hear that breast cancer is on the increase. Then you have cervical cancer, you have bone cancer, you have lung cancer, bowel cancer, all of those cancers. And some of us, as I said, some are self-inflicted, if you will. But I mean, and is the trend like cancer? Are these cancers, are they increasing? What's the trend there?
On the whole, overall, I can say it's increasing, maybe because the numbers of people coming to the hospital are now aware, so they come to the hospital. I look after, basically the surgical part of the cancer, where breast is part of that. I mean, breast cancers, maybe the lung cancers, the intestine cancers and liver cancers. I do a lot more on the intestine and the breast. Okay. So I take care of that. But some other people, they call them the ear, nose and throat, or the head and neck surgical division, they look after the mouth cancers, they look after neck cancers, and so. They have their own stats, they have their own numbers. And then the children's cancers, where they have blood cancers, leukemias, they have cancer in their kidneys or in the intestine. That's a children's doctor, the pediatricians, they look after them in a different section. So they have their own numbers. I cannot answer that in a bigger picture because this country doesn't have a database system for cancer. So I don't know what's happening in Mendi. I don't know what's happening in Medang. I don't know what's happening in Rabaltu, Nonga Hospital. Because we don't have a national database system to up-to-date information. We don't have that. It's fragmented. The system is not there. Well, so I'm only saying it from the breast because I look after breast only in Mosby. For the matter.
Well, our health indicators are not really good, and no wonder we don't have statistics on cancer. Well, it could also mean that you as a doctor are not speaking loud enough, are not speaking forceful enough to authorities, to government. Do you need to do that?
It's a yes from me. It's a yes from me. The reasons are that we have once a while, or every year, September, we have medical symposium. Mm-hmm. Okay, so we do present some states and some figures and some, and do recommendations. I'm not sure the responsible people need to take up to the chain of command to tell the health secretary, to tell that minister. The minister will take it to the cabinet, parliament, and say, we have problems, we have this. To me, for the last 5 years, maybe, this is distorted, or whether it's gone up, it's not coming down, So I'm not seeing the fruits of these things. I'm not saying that when it comes to the need of the people, the cancer people in the world, they're not getting the treatment I want. But the treatment we've been advocating for the last 5 years, I don't know. I mean, I'm on the ground. I don't know what the system here in there. But that's my feeling. But as much as possible in every front, I want my doctors to do that, to advocate, whether it's on the streets, whether it's a public rally, it's in a church. People need to know, because it's not like, it's like a flu and you get amoxicillin and you are done, Cancer, as we say,
is a death sentence.
It's as soon as you're labeled, the care in this country is not good, so you are just a dying, patient.
Wow, doctor, we are running out of time, but I hope that this is enough for people to think about it and for authorities to take it up to the next level. We're running out of time. Thank you for your time.
Thank you very much.
Okay.
Thanks.
That's been Dr. Arnold Wayne, specialist surgeon at the Port Moresby General Hospital. This is PNG Tonight. After the break, revitalizing Warirata National Park outside Port Moresby.